Good evening, Los Angeles. Thank you as always for joining us. I think all of us are going through a lot of fear and pain, and probably nobody more than our young people. And so tonight I want to dedicate this broadcast to our young Angelenos who are carrying so much on their shoulders, who are dealing with an unknown future, who are carrying the stress of their families and their siblings, of not being at school, and so much more, and who are the unsung heroes of this moment. And so I'm so glad that we're joined tonight by Michelle Cawley, who has more than 2 decades of experience providing therapy and crisis intervention services to students and to families, especially in marginalized communities. But we're going to turn to that after I do what I do every night, which is to make sure you have a snapshot of the data that you need to make sure you're informed about what's been going on since yesterday. Today, the county reported 1,400 new cases, bringing the total to 15,140 confirmed positive COVID-19 cases in Los Angeles County. This is a 10% increase since yesterday. As was the case yesterday, we're seeing a case spike because of a backlog of 734 cases that were being cleared. So today's reported case number is actually closer to 625. I know some of you follow these numbers as religiously as me and might be worried about the last 2 days in which we've seen our first 4-digit increases. But I want to reassure you that this is about testing capacity expanding, some backlog tests that have come up, and not necessarily a doubling in just 2 or 3 days. For comparison, the past 7 days, we've seen an average daily increase of about 758 cases. In the city, there were 680 reported new cases today, also including that backlog, bringing our total to just under 7,000 at 6,904 cases in the city, an 11% increase since yesterday. And the worst part of this evening, each time I report to you, is the 46 deaths that we added to the rolls. This brings our total to 663 fallen angels in our county, a 7% increase since yesterday. For comparison, the past 7 days, we've seen an average daily increase of 44 new deaths, and deaths are doubling every 7 to 8 days. I wanted to add one statistic today that 90.1% of these deaths are occurring with people with so-called comorbidities. That's just a fancy way of saying the folks that we know are the most vulnerable because of their age and their medical conditions. This is especially deadly to them. And we learned that over 50% of our households have somebody over 65 and/or people with medical conditions that make them especially vulnerable to death from COVID-19. And as always, my heart, our collective hearts, go out to each one of you who is mourning a loss tonight. California now, with our cases, is 30th per capita in the country. I know we often see the reports that we're 5th most cases, but we're a populous state. And we remain, because of our safer-at-home measures, in the bottom half of states per capita cases in the country. In our county, our general emergency hospital rooms still look pretty good. 1,433 beds, including 1,201 acute care beds, are currently available, as well as 232 ICU beds, and an inventory of 1,125 available ventilators. That's good news, but we know how quickly a surge can come into those intensive care units, and so we have to keep marching forward and keep staying home to keep those numbers good ones. So we're looking to keep folks healthy and safe and out of those hospital beds, so do your part to make sure that continues. There are now 34 testing locations across Los Angeles County, and today we have the capacity to test 12,200 people. By the end of today, we will have tested approximately 87,000 people just in those centers alone, add another 20 to 30,000 tests that have been through providers, and we're well north of 100,000 tests that have been conducted here, people tested in Los Angeles County, even more tests than that. There are, yesterday in California, to put this in perspective, 9,600 tests were reported conducted in all of California yesterday. 5,724 of them occurred just in our city and county testing sites. That's 60% of all tests in the state. Combine that with other tests going on in the county, it's probably closer to 2/3 of all the tests in the state were done right here in Los Angeles County, even though we're just 25% of the state population. Thank you to everybody who's working in a test center, whether it's a paramedic, firefighter, whether it is one of our core volunteers, or anybody who is helping step up to make sure we get more and more tests every single day. This is our second day of pop-up testing in Skid Row. 186 tests were done there, and hundreds more have been provided to people who are experiencing homelessness through our providers. We now also have 3 mobile teams that are surging into our senior care facilities, our nursing homes, and assisted living facilities. We've also conducted 2,500 proactive medical checks among people who are experiencing homelessness, and we found 100 symptomatic people who are experiencing homelessness and took 35 transports to get them to care and to a place where they can quarantine safely. We are offering same or next day appointments to anybody with symptoms, no matter how mild. And I want to reiterate what I said yesterday. Even if it's mild symptoms, please get that test. We need to know how many people are infectious in our city. We need to know in our county how many people have this so we can talk to their contacts and let public health do their work. So get a test today. Go to coronavirus.lacity.org/testing to sign up for a test tomorrow. Right now, I know every single day this crisis hurts more and more, financially, psychologically, and in the health of our county. And we're mobilizing every resource at our disposal to help you to get through this, and we will get through this together. Hospitality, and tourism industries, as well as janitors and security guards who work in our office buildings, have been hit among the hardest by this crisis. And as a result, tens of thousands of hotel workers, of food service workers, of airport service workers, janitors, security guards have been laid off or furloughed and are now trying to make ends meet without pay. Putting these folks back to work may seem like a long way off, but we have to start preparing for it now. Skilled workers who lost their work need to be the first ones to be rehired. In other words, those folks with decades of experience and seniority who support families and communities can't be the victims when we get back to work of people who are either newer or paid less being hired underneath them. So we need to protect them. And I'm so glad that tomorrow the City Council will take on, led by Nuri Martinez, our Council President, Council members Mike Bonin and Paul Koretz, Marquise Harris-Dawson, and Curran Price, legislation that would create a right of recall for those workers, a worker retention ordinance that will allow those workers to come back to those jobs where they greet visitors, where they protect us and our buildings, where they do the work to help a meal get onto a plane flight, or to make sure that we can contain this crisis by being the janitors who make sure our buildings and our spaces are safe. For so many thousands of displaced workers in these industries, this could mean at least a little bit of certainty at this moment of so much insecurity and a whole lot of fairness as we navigate this crisis. Again, thank you to the council leadership and the council members who are leading on this issue, and I will sign that as soon as it comes to my desk. But let me be clear, there's only so much that we can do locally, and our businesses will suffer. Our unemployment rate will continue to grow even higher without full and complete support from Washington, D.C. Now, our federal support has come in stages. First, the stimulus bill that came in the first round was focused on preparedness and emergency response. The second one on sick leave and unemployment insurance, and the third, what I call the survival package, on support for working Americans and businesses. Today, the Congress and the Trump administration reached a deal on an interim package, some are calling it 3.5, to address gaps in that survival package. There were too many small businesses that couldn't get loans, who didn't bank with the big boys and girls, so couldn't have the access. And here in California, we certainly were a victim of that, and I'll get to that in a moment. So let me first say what is positive with what happened today and thank our leaders in Washington. First was the much needed funding, $310 billion for the Paycheck Protection Program and $100 billion for our frontline hospitals and to expand testing. That couldn't have come too soon. And as this bill becomes law, we have to ensure meaningful oversight happens as well. We should make sure no big handouts go to folks without the everyday workers and Americans getting the benefit because they are the ones who are suffering the most. Up to this point, California, the largest state in the country, received the fewest number of loans in the nation per 1,000 small businesses. As I said, too many of our Main Street businesses didn't have the banking relations to get the loans. So I support our senators' oversight to make sure that this support lands with the kind of businesses we see in our neighborhoods right here in Los Angeles County, the place we get our hair cut, the place that we pick up some food, the places that are on our main streets of our neighborhoods, often run by women, people of color, immigrants, small business owners, veterans, and others who have always had a dream of opening up a shop or a salon and who need to have this help so that they can get back on their feet. At the same time, let me say what is bad with this deal, the things that were left out. As I've said in the State of the City address and many nights here, we need to have assistance for our states and our cities. By leaving that out, this means that 13% of our workforce nationally was left out of this assistance. Not only that, investing in our cities is investing in America. I don't have to tell you, if we cut services, cut hours, and cut people, what a destructive effect that would have on our local and national economy. These are investments in our well-being. These are people who are working on the front lines for our health and safety, transporting COVID-19 patients, helping vulnerable folks like seniors be fed, taking people who are experiencing homelessness off our streets, and we need to make sure that Washington recognizes that and moves forward. But fortunately, there is a good glimmer of hope, because we saw Speaker Pelosi and Leader Schumer put this forward. We saw some support from folks who were Republicans as well, and President Trump today tweeted that we need to now turn to states and to our local governments to give them the fiscal aid to get through this crisis and to fill the holes, not just to reimburse the costs of this crisis. I look forward for the fourth round of stimulus negotiation getting done quickly, that aid to arrive immediately, and for us to be able to look at what we can restore, grow, and rebuild, as we don't just reopen in the future, but we also recover and reimagine what lies ahead. And I will never stop being loud about those that have been left behind, specifically our immigrant communities who still are excluded. Families, because if they have one person without documents, can't get a check. Folks who are working hard to make sure our food supply is picked, is transported, who are processing our food, working in our hospitals, cleaning to make sure that our doctors and techs and nurses are safe. We need to make sure nobody is left behind. And when it comes to immigration, immigrants are not the threat to America. COVID-19 is. Let me be very loud and clear. Let us not be distracted from what is at hand, and let us make sure everybody is included in our aid together. We have shown that we cannot and will not wait for federal aid to act, but we know how important that aid is. And that's certainly the case here locally in how we're helping our young people and those who support them, our teachers, our students, the many innocent victims of this crisis. And I want to thank the district who has stepped up with teachers and supportive staff who are delivering meals, learning how to teach remotely, trying to get technology in the hands of all students, dealing with internet inequality, and making sure that we can stand up education, that our young people, many of whom cruelly start way behind the starting line, that they don't fall further behind because of COVID-19, that the inequality in our city and in our country doesn't become exacerbated by COVID-19, but that we look at this as an opportunity to help them, each and every one of them. I encourage, first of all parents to go to our resources page at coronavirus.lacity.org/resources. Check it out. There's information that I've shared in many different evenings, programs you can sign up for, financial assistance and cash relief, the ways that you can get help of food, benefits, places you can go to make sure you have an internet connection for free or very low cost, places that you can go to help your families no matter what kind of family you have, no matter where they live. And I want to thank the thousands of UTLA teachers, counselors, and school nurses, the Local 99 teaching assistants, custodians, cafeteria workers, and other education workers who are out there on the lines doing everything they can to help our young people. Not to mention parents who will never again ask, so what do those teachers do and what do the support staff do? We love you and we support you for everything you have done. Each one of us that's trying to teach a child at home, and I'm one of those teachers. I hope, Maya, you've been enjoying the classes, but I know that you're skilled teachers and teachers throughout this city are the ones who can't wait to see everybody back in class. But let's focus on young people for a moment, because I want them to know that not only are we focused on the city at large, we're focused on them specifically. The old cliche that children are our future, I've always rejected. Children are a reflection of our present. They're not the leaders of tomorrow. They are leaders here today. I had a very powerful experience yesterday when I asked my team to help me reach out virtually to the young people of Los Angeles. And so we put together a discussion with Dr. Barbara Ferrer and myself with young people who are in our primary, middle, and high schools across Los Angeles. It'll actually air tonight on my Facebook page at 6:30 and on KCET. And the same way folks get to ask me questions from the press every night, and I appreciate you so deeply, members of our press, who have been reporting all the information that people need to know and asking the right questions. I wanted to give our children the opportunity to ask their mayor and their director of public health those same sorts of questions. And they shared powerfully what their stories were, what it's like to be on the front lines. One of the things I said to them is, you're not powerless, you are powerful. I heard the stories of a set of sisters whose parents are both on the front line as medical workers, of children with pre-existing conditions while their parents are still critical workers gone, who can't leave the house but have to figure out, how can I get groceries for my siblings? They wanted to express the sadness of what it felt like to miss prom, their own graduations, the care they have about wanting to make sure immigrants aren't left behind and that people can pay their rents. And they wanted concrete answers about when things would get back to normal. Some have found themselves in a dark place, struggling with the depression that they face, missing their friends, wanting to get out. And they're reeling from the loss of life. We all know how tough childhood and teenage years can be, but also how vibrant it is. That to be out there experiencing life, to have that cruelly taken away, how tough that has been. And it's not just younger people who are feeling this weight. The psychological burden of this pandemic is weighing on all of us. And I always get together and just talk about the stats that you need to know, the programs that we're launching, but I want us to also focus on our mental health, because this is tough. We're carrying pain, we're scared, we cry, we get angry, but there's also a lot of bright moments where we find the connections and the way to get through this. Data shows us that the tremendous emotional strain this time has placed on the values of essential workers, especially from those in our emergency rooms to the ones that are stocking our shelves. But we are all feeling that. That's my message to young people and their families today. Our lives have all been interrupted, suspended eerily and indefinitely. And it's now normal to feel quite alone. That's okay. But we need to talk to each other. We need not be worried. We need to not hurt as much. We need not to feel powerless. And in this moment of challenge, more than 50% of the people who are reaching out, for instance, to the crisis text line that I've talked about at 741-741, are turning to therapy and mental health services more than they usually do, accessing resources that exist precisely for moments like this. So there is no shame in reaching out. In fact, you're the strong ones if you do reach out, and I encourage you. So that's why I invited today Michelle Cawley, a leading therapist in Los Angeles and licensed clinical social worker, to share some steps on how all of us can cope during this time. Thank you, Michelle, for joining us, and I'll turn it over to you.
All right. Thank you, Mayor Garcetti, and thank you for having me and bringing light to mental health. COVID-19 has taken a real impact on multiple aspects of our lives as it relates to our mental health and our emotional health. For many families, regardless of socioeconomic status, stress and anxiety is widespread, and it filters into many aspects of our lives. Working from home and schooling from home, it's tight. Spaces are tight, there's sound, there's internet, dogs are barking, kids are crying. It's really difficult. Job losses, that means revenue change. Am I going to be able to pay the bills? Are my parents going to be able to pay so that I can go to college because I'm graduating this year? There's also the school closures and what that means. Students missing their friends, their families, their teams, those are all communities. Those with pre-existing health conditions, this right here also has an impact, especially on communities of color. Loss and death, and with that comes grief. There are also other types of losses. Losses of, what does this look like? How long is this going to last? Can I plan for the summer? Am I going to be able to go to prom? Am I ever going to have a graduation? That's called anticipatory anxiety because we're anticipating. So let's take a look at mental health and a little bit more of depression and anxiety. Let's just review some of the signs and give you parents something to be aware of and cognizant of. Within depression and anxiety, it can look different in all of us, and those symptoms vary from person to person. So within adults, depression can look or feel as if you're just having a down mood. Some people call it, I just feel blue. Some people don't feel depressed at all. They just experience a loss of pleasure, and those things that they normally would do, it doesn't feel good anymore. There are also things like appetite changes. I've gained 10 pounds, I've lost 10 pounds, I don't have an appetite. Sleep patterns can be off. This is where insomnia can peak. And then there's just a sense of agitation. There are more, but those are just a few. Depression looks a little bit different in children. There's a sense of sadness or even hopelessness. Irritability. Sometimes we know when our children feel irritable. You might ask, what's wrong with you? But remember, this can be a symptom of anxiety. And then with children, sometimes they report, Mom, I just feel bored, or having low energy, or just poor concentration. So that's all a symptom of depression. In terms of anxiety in adults, there are symptoms that are internal and external. So some of the internal or emotional symptoms are just worry and rumination. We worry a lot, worry about everything. How long is this going to last? If I cough, does that mean I have COVID-19? Trouble concentrating, anticipating the worst, just the anticipation of everything, and just feeling tired. Some of those external symptoms, it can mimic cardiac arrest. I am feeling like I'm having a panic attack. Or it can be something like just an upset stomach, headaches, tension, fatigue, insomnia. Anxiety in children also looks a little bit different. Extreme and unrealistic worry about events, especially COVID-19, being really self-conscious, a strong need for reassurance. And then some of the complaints, just physical complaints, when there's really no physical basis for it. So with those symptoms of depression and anxiety, let's just look at some of the to-dos and what we can do about it. The first thing is acknowledgement for both adults and children, allowing ourselves to acknowledge what's going on. And what I mean by that is giving ourselves space to be able to really openly talk about that. So I know what I'm feeling. I'm feeling tired. I'm sick of this. How long is this going to happen? Unpack those feelings of what it means. And hopefully that will give either you or your child clarity around it. So for teens, just being able to acknowledge, I'm just really disappointed. I'm not going to have a graduation this year. I'm not going to be able to go to prom. So once we've given ourselves permission and we've acknowledged that, hopefully then we can transition into helping others. And what that looks like is communication. There's no substitute for communication. So just literally opening your mouth and communicating, being able to articulate the feelings. So for parents, when our kids come to us, sometimes it's not about, okay, as a parent we need to fix or we need to problem solve, but sometimes we just need to listen. With our spouses, our families, or our friends, this is a way to deepen our communication and our connection. With our families, that means creating new ways, whether it's the virtual, whether it's over the phone, or whether it's letter writing, good old-fashioned letter writing. The third thing I want to mention, and the last thing, is creating a list. I'm a big list person, so writing things down makes them real. So this is also going to look different for everyone. So think about how you might have coped in the past when there has been something really stressful going on in your life. Maybe you need to call on that strategy if you've used that before. But as we move forward to take care of ourselves, here are a few things I encourage you to do. And I also suggest that you be realistic, because what might look right for someone else might look different for you. And if you need to reach out to a mental health professional, reach out, whether it's for yourself as an adult or for your child. Get your child some help. At this point, telehealth, via whether it's video or phone, is easily accessible. There are also support groups. offered online by lots of different topics, and there are a lot of free support groups at this time. 12-step meetings are really important and a source of online support. Nurture your own support system, whether it's your family or your friends or your neighbors. Other things, exercise, you get that endorphin release. Prayer, mindfulness and meditation, journaling, positive affirmations. Pay attention to your nutrition. Managing your money, especially if this is a source of stress or conflict for you, maybe this is the time to take some time and look at your finances. And gratitude. If you or a family member has been impacted by COVID-19, it can be easy to get sucked into that negativity, but finding maybe 3 things that you can be grateful for daily can help with optimism and hope. Thank you so much.
Thank you, Michelle.
Thank you.
Those words are so powerful, so basic, and yet we forget them so often. And I want to thank you, Michelle, for reminding us about what's important. And I want to thank folks who are broadcasting this for keeping this information out there. This is as critical as any program, any data that we share, to look after ourselves during this. And this happens to all of us. To the young people that are out there, your mayor gets stressed, I get stressed. I have moments where I have a panic attack, or where I have to write down what's stressing me out, where I have to pick up the phone and talk to somebody. None of us are immune from this. And though I'm used to a lot of stress in this job, this is unlike anything any of us have gone through before. So give that stress, give that anxiety, give those worries a voice. And the first part is seeking help. And if you do need help, here's a couple numbers I want to share with you. The county's Department of Mental Health has a 24-hour access center at 800-854-7771. It's 800-854-7771. For LAUSD students and families, I've previously shared the district's phone hotline, where you can talk with counselors and mental health professionals between 6 a.m. and 6 p.m. on weekdays. Let me share that number with you again. It's 213-241-3840. 213-241-3840. And as I mentioned before, anyone can also just use your phone and text 741-741 to connect with a crisis counselor at the Crisis Text Line, an organization run and founded by Nancy Lublin, a dear friend of mine for many years, and it's part of my crisis response team's referral process. All of these resources and numbers, if you forgot any of them or didn't catch them, are available at that coronavirus.lacity.org webpage. Just click on resources. And let me just reaffirm in closing Michelle's message. Speak directly to every person in Los Angeles, young or old, healthy or sick, struggling or getting by. We haven't been through anything like this before. The headlines are incessant, the challenges are so significant, and I know that the isolation is real. But whatever you're feeling, know that you're not alone. We're all feeling this together. And when I say that we will get through this together, I mean it. This is not a permanent new normal. This is a period of time that will pass, and we will pass through it together with the strength that we gather when we give voice to our isolation, when we join hands virtually to march forward through these foggy days until it is clearer ahead. So breathe. This is not forever. Do not despair. There are signs of light, and we will get there because you continue to stay healthy, to stay safe, and to stay at home. All strength and all love to you, Los Angeles. Thank you. With that, I'm happy to answer questions for today. I'll take the first question.
And our first question comes from Joseph Cerna from the Los Angeles Times. Please go ahead.
Hi, good evening.
Hi, Mayor Garcetti. Thanks for taking the time.
Sure.
Just a quick question. With Riverside and Ventura counties easing their restrictions and Orange County under a similar pressure, how concerned are you that LA residents might start to violate our shelter-at-home orders here? And what do you plan to do to maintain their cooperation?
So of course, I'm always worried that folks won't stay at home because we know staying at home saves lives, but I'm very proud of Los Angeles. I go to national polls that show, regardless of political party, no matter how much people want to make this partisan, no matter where people live, that over 2/3 of Americans are worried that we will open up too early. And I always say 10% of 10 million people, that's 1 million people, that's a lot of folks. But I will continue to take my advice from doctors, from science, from data, and from looking at experiences elsewhere. We won't be pushed by pressure into doing things early, but I also have promised we won't wait one day longer than we need to. So I do hope that Los Angeles will continue to abide by what our advice is from Dr. Ferrer, and then how we process that collectively between 88 cities and the Board of Supervisors. We have those conversations every day. There's not a day that goes by. There's not a secret date where we're reopening, and there's not a delay that we will wait for. But that said, we cannot afford to let up. This weekend will be a very warm weekend. People will want to go outside. We have to stay home. We have to make sure that we continue to. We've seen this kind of bump up in cases. That's primarily from backlog cases, but it's a reminder. When this weekend we had 81 deaths, we see again today over 40 deaths, that there are human consequences. And if the USC study is representative and right, 96% of us still have not had any exposure and are definitely not immune to COVID-19. Do the math for 9,600,000 people, and that could be chaos, death. It could make other places dwarf in comparison. So just remember what I've said this entire time. You can be a lifesaver and you can be a life taker. We need to continue to look back and say we got out of this safer, with fewer deaths, and sooner because we stayed at home. And until that date comes where we test baby steps, see how those are working, take bolder steps, we will continue to do this work and do it well. Thank you. Next question.
And that comes from the line of Claudia Pishuda from KNX News Radio.
Hi, Claudia.
Go ahead.
Hi. Just want to talk a little bit more about Union Rescue Mission now
Sure.
that they're basically testing all guests and staff, regardless of whether they have symptoms. They're up to at least 56 cases, and dozens more are still waiting for results. The CEO there, Andy Bales, is calling for universal testing on Skid Row. And I've asked you about this also at facilities like nursing homes where people are at high risk. Can you talk about efforts to try to ramp up testing to include the asymptomatic, especially in places where they are at greater risk for severe illness or death? Thank you.
Absolutely. Thank you, Claudia. Yeah, there were, look, I love Andy and I love everybody at Union Rescue Mission. They had, unfortunately, 1,200 people crammed in there. And we've worked closely, the county and the city, with trying to decompress that. Because in a crisis like this, I know that that comes from a heart of not wanting to turn away anybody, but that was a danger and is a danger to anybody to have people crammed in that much. So it's been decompressed now to 400 people. The Department of Public Health has surged people in there. The testing has happened there. They're suspending new admissions. They've implemented cleaning and environmental protocols. The 227 tests, 171 came back negative, 56 positives, really from a men's dorm where people were together, and those 56 are now quarantined in the sprung structure that's on their parking lot. So they've been very and we're being proactive with asymptomatic folks there too. As soon as we continue to get more and more tests, we are absolutely not only open to that, but remember, the city is just trying to surge and help tests. It's not something, we don't have a public health department, we don't have a health services department, but we're proud to work alongside this county, work alongside providers and others, and every moment I get a few more tests. When I had that UPS announcement a few weeks ago, the first priority of any extra tests was exactly for those people who can't drive to a drive-through center. I said, let's get that to our seniors, and let's get that to our people who are experiencing homelessness. So already, we've probably done 4 digits worth, so we're into the thousands now of tests that have been done between our senior homes and our people that are experiencing homelessness. But we can't do those quickly enough. And I'm particularly concerned with our senior homes. We've got 43,000 beds and many more workers worth of people in LA County. And those really are the most vulnerable people by their age and pre-existing conditions. That's where we've seen a lot of the deaths come in the country. I'd love for us to, working together with the federal government, just passing new money on testing, the state that I know is ramping up, to be able to regularly mandate and test those places for all the workers and for everybody that's there. And then secondly, to make sure we have those excess tests going to people on the streets. And I want to thank those outreach workers who have done those wellness tests, now in the thousands, because that is getting people off the streets quickly who are symptomatic. And at Skid Row, with a pop-up center that we have, for instance, is one that will continue to test people who have symptoms or who want to get a test. And if we build that capacity, absolutely, we need to make sure that everybody from both of those populations, seniors and people experiencing homelessness, are tested regularly. So thank you to the work that Union Rescue Mission has done around what happened in their facility, what the county has done to help them out too, and our firefighters who are on Skid Row running these test centers. That's not anything that was ever in their job description, but as soon as we get more tests, we're going to continue to ramp those up more and more and more. Thank you. Next question, please.
Thank you, and that comes from the line of Alex Michelson from Fox 11.
Hey, Alex.
Please
Missed
go
you
ahead.
yesterday.
Hi, Mayor. Good to talk with you. I have a question I've gotten from several viewers in the nonprofit world who the services are needed right now, but fundraising almost impossible with so many people being hurt. Their fundraising events have been canceled because they can't socially gather. What's your advice for people in that space who really want to help other people but are struggling to put things together?
My heart goes out because nonprofits are not just great providers of services, they're huge employers. From our universities to charities to folks that every day are fulfilling some of the needs that we see so many people stepping up to during COVID-19. And exactly when we need them is exactly when they don't have enough money. So a few things. One is I would encourage everybody who's here, if you can dig even deeper, give something to a charity that you've supported. Give something to a nonprofit that needs you. I was speaking to a director of a huge umbrella of nonprofit, both religious institutions and community institutions, and he said, we can't look at doing a fundraiser probably this entire year, and so many of our institutions depend on those events and those moments. So please do, if you've gone in the past, if you've gone to a dinner to support your local YMCA, know that they're providing showers right now to people who are experiencing homelessness and they don't have any dues coming in, so help them out. If you know your church or your synagogue or your mosque, you're not there tithing, do it anyway to help them survive, keep those jobs going and all the help that they're giving us. Second, a lot of people don't realize nonprofits can apply for the business assistance, both of the federal and local programs. So just because you're a nonprofit doesn't mean you're not a business when it comes to these funds. So again, go to our webpage, look at those business assistance programs and apply for them. I know PPP was sold out early. This next round now that's just going to be passed this week will provide another $310 billion. Make sure that you step up because, as I said, California got the least per capita of any state for our small businesses. That includes nonprofit organizations as well. And third, I would just say, look, I'm committed to making sure as we rebuild that we don't think about these organizations as lesser than our businesses because they are so important to the lifeblood of Los Angeles. And so as we look at whatever programs we get from Washington, Sacramento, or can generate here with the dollars they send us, we absolutely will be looking at that. Great example is grants that we put out from our Cultural Affairs Department for community nonprofits in the arts whose performances or shows were canceled to be able to get grants now to help them keep their people creating, employed. This isn't just a great place of service and creativity. These are huge employers, and we need these to be alive, well, and rebuilding in order for our economy to prosper. Thanks, Alex. Next question, please.
Thank you again. If you'd like to ask a question, press 1, then 0. And now to the line of Steve Gregory from KFI News.
Hey, Steve. Good evening.
Hey, Eric. Good evening. Listen, quick question about testing sites. You mentioned last night that 100,000 Angelenos and people in the county have been tested. Dr. Ferrer says 89,000 people have been tested. I'm just wondering where the testing numbers are coming from.
Sure.
Secondly, testing sites. We're getting some pictures from listeners now that are traveling around the area, and a couple of people that went for testing in Sherman Oaks, and there were no people there. There was just a couple of the testing people, and this has been like this a couple days in a row where no one's been going to these testing sites. I'm wondering if you're getting any data from how busy these testing sites are around the city, and would those testing sites be sort of repurposed, put somewhere else, or relocated if they're not being utilized in those locations? And finally, sometime back you mentioned that nursing home residents would be moved out to the USNS Mercy so that they could work on the nursing homes and get those people out so they could sanitize and clean. I'm wondering if there's been any movement to that because the ship says it's ready to receive people, but no people have been transferred. Thanks, Eric.
Sure, you bet. So, Steve, with the first one, USNS Mercy, I don't know of anybody that's arrived. I think the state was coordinating that and looking specifically at helping some folks come from Orange County. So it's available there as a regional resource. I'll check with the state. I don't have any information that anybody has yet from those senior homes or nursing homes. In terms of the testing sites, there's a combination of testing sites. Some are run by the city and the county. Other ones are done by providers or volunteers. So it depends on each one. But you're absolutely right. And one of the reasons each night I say, go get tested, is there are days in which we might have 10,000 tests and we do 7,000 worth. So we definitely do have the capacity to have more people tested, but we don't think that's because we're testing too many people. And as soon as we hit kind of a place in which, look, we no longer have the demand from symptomatic people, I'm going to get the advice from Dr. Ferrer, what sort of asymptomatic people should we be testing? Do we move that and make sure we get more of those tests into our nursing homes if we can take those sorts of tests in? We need people to do that. It's much tougher than drive-through facilities in terms of the people power. Can we bring those to people who are experiencing homelessness, et cetera? So I'm not worried we have too many tests. Quite the contrary. We still need more and more and more. But if the population that's symptomatic and has access to a car isn't there, our walk-in centers are still very busy. Certain neighborhoods are very busy. So we'll always tweak that. And some of those centers may be run by private organizations, or people might not know of them. They might also be there from service providers or other cities as well. In terms of the testing numbers, the 89,000, we're trying to reconcile these numbers, but we know for sure that a lot of our early city-run testing sites weren't in the big number from the county, so we combined that number with theirs. Now they are including the city ones and the county ones together, so we're pretty confident it's about 20 to 30,000 more than that 89,000 number that's officially there. So it's probably more in the ballpark of 110, 120,000 people that have had tests done. The number of tests is even higher than that because sometimes people need to take a couple. So we're confident about that. Let me see if I missed anything else. I think, yeah, that covered everything else. Thanks, Steve. Next question. Next question.
Thank you. And now to the line of Elizabeth Chow from LA Daily News.
Hi, Liz.
Go ahead.
Hi, Mayor. This is so I wanted to ask about the testing timeline. I haven't heard how soon you think, how long it would take for more people to be tested, especially at nursing centers and also nursing homes and also at homeless shelters. I know that it's still a ways off, but I'm interested in hearing an actual timing for that. And I also was wondering if you might be able to share what it's been like to bring up testing capacity. What are some of the challenges that you've faced or the county has faced? Why are we still at where we are right now?
Great. Thank you, Liz. So we have surged, obviously, into senior homes, into looking at people who are experiencing homelessness, and we are testing asymptomatic people in those locations. So we've already opened the box of asymptomatic people in high-risk environments. So when we hear that one or two people in a senior home has it, everybody, whether they have symptoms or not, is getting tested in those places quite often. And we're doing that also in areas, whether it's, for instance, we've talked about this in Granada Hills or in Westchester or other places. If somebody is COVID-19 among people experiencing homelessness in congregate shelters, we've done that as well. The challenges for testing, there's no set timeline because so much of this depends on the tests that we get through. And I want to remind people that the City of LA is stepping up and using our money, as the county is now too. We only get 75% reimbursement. That's something that needs to change at the federal level. When the federal government said anybody wants to get a test can get one, there weren't enough tests for people to do that. And this is something that we're having to find money for, cut other city programs, et cetera, to be able to pay for the 25% we are not going to get reimbursed for. So first of all is how many tests are there? Second is what is the lab capacity? We saw early on, we started using certain tests, we sent them in, it was taking 5, 7, sometimes 9 or 10 days to get the results back. That's not very helpful to somebody with symptoms, nor us tracking and tracing who they've come into contact with because it's too late. So we had to find the right places that had the lab capacity that can turn them around in 24 or 48 hours. And as we build that, we have to continue to find the number of tests, the number of labs, and then the people. I had to take firefighters off of their jobs responding 911 calls and other things to stand up these centers. Groups like CORE stood up. I know the county has had the same headaches and problems. It's why I've called for a CARES Corps that can help with tracking and tracing nationally, that can help local communities stand up these testing centers, and that can maybe have surge teams that go into our senior homes, that can go out onto the streets where we have vulnerable populations experiencing homelessness and stand that up. So every day we revise. I've been very proud that every night I've been able to report to you, hey, we added another 500, another 1,000. Our capacity is now 10,000, 12,000. Those things, I think, second to only maybe one or third to one or two cities in America. As I mentioned, we had nearly between 60 and 66% of all the tests in California that were reported yesterday. That's pretty amazing, but it's still not enough. And I'll tell you lastly, my dream, a lot of people talk about the blood tests, and we've discussed this, the serology tests. I'd love for serology tests and virology tests, the ones that we're doing through our drive-through centers and our walk-up centers, to be able to go hand in hand so we can see if somebody's had it and if they have it. We really need both of those things to make some of the decisions about what we open up. I need to know, based on the advice from Barbara Ferrer, from the folks at Public Health, I need to know how many people on average are contagious in this city at any given moment. Is it 35 people for every 100,000? That sounds like it's getting big. Maybe we need to, again, shut down some of the city. But if it gets down to only 5 people for 100,000 by taking a random sample, maybe that shows that we can open up the aperture, return some people to school or to work carefully and safely. And those decisions will really depend on testing capacity. So sorry to go on for so long, but I know a lot of discussion at the national level said, we don't have enough tests to open up the economy. They're right, but usually what's said next is wrong. It's not about the blood tests, because when we see from the USC study, probably 95, 96% of us haven't gotten COVID-19. You can have as many blood tests as you want. All they're going to confirm is that we're still vulnerable. But if we can look at contagiousness, that helps us begin to assess whether or not we might be able to safely get some people back out to schools, to work, and into public spaces as well. Hope that answers those questions. Thanks, Liz. Next question, please.
And that comes from the line of Lisa Marshall from NBC4.
Hey, Lisa.
Go ahead.
Hi, Mayor. Thanks for taking my
You
question.
bet.
From what we're seeing on Skid Row, very few homeless residents have shown up to get tested at the pop-up testing site. You said today that 186 tests were conducted at the pop-up testing center, but that equates to only about 4% of the Skid Row population. So with that, how are you going to get more homeless people to agree to get tested?
Sure.
Should test site workers be approaching people in their tents?
So they are medical, as I mentioned, I forget the number, I think it was 2,500 medical wellness visits already and counting each day. So it's a three-part strategy. We're working with those doctors who already provide health care that people who are experiencing homelessness trust and know and have gone to for months and years, because people get sick on the streets all the time. They do have doctors that they go to, and so it's not just something random and pop up. And with folks who are experiencing mental health challenges or other things, they might not trust something new, but they do trust somebody they've been to before. So there's hundreds of tests that are going out through those providers. Probably more than 1,000 already have gone out there. On top of that, a couple hundred a day, if we keep up this pace, will absolutely make a dent. 2 weeks of that, you're starting to make a real dent. That's covering more than half of Skid Row in just a couple weeks. And I'm very proud of that capacity and what LAFD is doing. And then third, we're also looking at those places like, for instance, what happened at Union Rescue Mission, being able to surge tests in there. The county is helping with that. We do that as well, and in congregate shelter settings. So, I don't know the numbers. I'd have to look at it. But I would venture to guess so far, we have as many tests per capita of folks who are experiencing homelessness than those that are housed. And that that ratio will only get bigger and bigger and bigger, so that we will continue to get to a higher percentage. In other words, if you're experiencing homelessness, you're much more likely to get it to a test, to hopefully when we get to close to 100%. But you do rightfully say it's difficult work. There is no easy answer. To great outreach workers, what we try to do is go with people who are trusted out there on the street, who have built a relationship not just for a few days during this crisis, but for weeks, months, and years. Some of our amazing organizations that are out there on the front lines, downtown, South LA, and the San Fernando Valley, and Venice, and Hollywood, who have these relationships and know these folks. I talked with one doctor who does a clinic for years, and he does that at a feeding line. So everybody knows that doctor, and they can help then convince them, hey, are you asymptomatic, or do you have a fever? If you do, let's get you there. And so with those 2,500 folks that were reached out to, only 100 of them had some symptoms. We were able to treat them right away, to get them not only tests, but get them, more importantly, to a place. You can get a test and tell somebody they're positive, but the most important thing to convince them is if they are positive, go into one of those hotel rooms, go into a congregate shelter where there's the safe spacing and meals and medical professionals. So that part is working. But you're right, we need to keep pushing until we get that number to close to 100%, not just a good number already in the first few days. Thank you. Next question.
And that comes from Keely Webster from Bond Buyer. Please go ahead.
Hey, Keely.
Hi. So I have a couple of budget-related questions.
Sure.
In 2008, the city also implemented every other Friday furloughs for many employees. Are the extent of the furloughs more widespread than they were then?
No, it's right. What is planned right now is the same, and it mirrors, I think, a lot of the same critical employees who won't be furloughed, as well as the rest of us that will.
David Crane, the UC public policy professor, suggested LA eliminate or reduce retiree medical programs, i.e. OPEB, for a $300 million annual savings rather than furlough employees and reduce city services. Has the city considered anything like that?
Well, the city can't consider any of those things single-handedly. Those are all have to be negotiated by law. But absolutely, we've looked at not only reducing, and I'm very proud of this. This was over 10 years ago now when I was city council president. I think we went further than any big city in America in terms of doubling, in some cases quadrupling what people's pension contributions were, including for their retiree health. But we're absolutely open. I said a dollar is a dollar is a dollar. Sometimes people fixate on pensions, sometimes people fixate on healthcare, sometimes people fixate on something like a furlough, but anything that, or raises, and anything that we can do to keep reasonable increases and to not go above and beyond are dollars saved. So as bond raters showed, in the last couple weeks, Los Angeles with its reserve fund kept stable and kept at the same rating. And we intend to do everything we can to keep that going through responsible right-away hiring freezes, proposing a balanced budget, even if we have to use it for furloughs. But my message to anybody in any of the unions, we are more than happy to sit down. I think we need to get through these days first, that it's not appropriate time to have that when we have first responders on the line right now, risking their lives, city employees that are out there trying to figure out new jobs. That's not the right time to have that stress. The furloughs will accomplish that in the same time. But I've also said I'm very hopeful that if the federal government can come through and actually make us whole too, not only can we have this expanded critical healthcare services, but we can establish some of the cuts that we'll have, kind of the haircut across all city programs, and ensure that our economy stays strong by making sure people can get paid and keep their jobs. Thanks, Keely. Next question.
Thank you. And now to the line of Gabriel Horta from Telemundo. Please go ahead.
Thank you, Mr. Garcetti.
How you doing?
The question is, what additional actions could city take regarding the situation at the Union Rescue Mission? And what is, in general, the assessment about Skid Row? En español, la pregunta es, ¿qué medidas adicionales podría tomar la ciudad en relación al brote registrado en la misión Union Rescue? Y en términos generales, ¿cuál es la evaluación de los contagios en el área de Skid Row? Gracias.
Gracias. And let me just say briefly in English, I'll answer in English and then Spanish. As usual, I'll go to my Spanish remarks. I want to thank Michelle again. I was hoping she'd get some questions because she is so smart, such a great resource, and I hope folks listened. Reminder at 6:30 on our Facebook channel on KCET, we're going to have that conversation with young people. If you're a young person or have a young person in the home or just interested in hearing the voice of young people, please do tune in. I did answer that in in English, so let me just go straight into Spanish about the Union Rescue Mission. La misión de Union Rescue fue un número de casos. Hay 56 casos. Y este es un refugio privado, pero tenemos los recursos del condado, del Departamento de Salud Pública, la ciudad, para ayudar con las pruebas, con asistencia. Desafortunadamente, había muchas personas en esta facilidad durante una crisis como esto. Había 1,200 personas en este espacio. Por eso nosotros hemos trabajado con el liderazgo del refugio a reducir el número de personas. Y ahora, gracias a ellos, solamente hay 400 personas en el refugio. El Departamento de Salud Pública está en el sitio con pruebas. Hay una suspensión de nuevas admisiones Y también tenemos nuestras políticas por limpiando por el medio ambiente, y hay muchas pruebas, exactamente hay 227 pruebas. De estos 56 fue positivos. Las personas en esta área del refugio ahora están en una nueva área en esta misión, y estamos dando las pruebas a toda la gente allí, no solamente personas con síntomas. Este es un ejemplo de el equipo del condado y la ciudad a asistir personas en nuestras calles, en nuestros refugios. Y tengo mucho orgullo del trabajo de las personas que están en nuestras calles. Hay 2,500 interacciones con personas en las calles a examinar sus síntomas. Hay 100 personas con síntomas en las calles, y nosotros tenemos la oportunidad a dar a ellos habitaciones en hoteles, moteles, doctores y otros profesionales médicos a asistirles. Y es mi meta con un nuevo sitio de las pruebas en Skid Row. Necesitamos tener más pruebas por los indigentes en Los Ángeles y también las personas de tercera edad que están viviendo en estas casas de personas de tercera edad. Estas son las dos poblaciones más vulnerables. Y ahora hemos dado más pruebas por cápita a las personas que están en los refugios y en las calles, de las personas que viven en casas, en hogares. Pero necesitamos tener una estrategia con el condado, el estado y el gobierno federal a dar 100% de estas pruebas a toda la gente en las calles. Gracias. So with that, I will turn to Spanish. Thank you again to our young people. I really want to end where I started tonight, dedicating this to you, to your strength, to your leadership, and to your power. And don't be afraid to talk to someone, whether it's a friend, a sibling, a parent. Give voice to what you're feeling, and we're going to get through this together. Muy buenas tardes a Los Ángeles. No se puede describir lo que estamos pasando en estos días, pero les quiero recordar que es válido sentir miedo. Todos estamos compartiendo el dolor, especialmente nuestros jóvenes en el condado de Los Ángeles. Pero ahora comparto los datos de hoy. Hoy hubieron 1,400 nuevos casos en el condado de Los Ángeles, llegando a un total de 15,140. En la ciudad tuvimos 680 nuevos casos, llegando a un total de 6,904. Y hoy fallecieron 46 personas más en el condado, llegando a un total trágica de 663. Y nuestros sentimientos siempre están con las familias que tienen un miembro de su familia en este fallecieron. Y estamos haciendo todo lo posible para apoyar a nuestros hospitales a prevenir más muertos. En nuestros hospitales tenemos 1,433 camas disponibles. Entre ellas, 232 están en las unidades de cuidados intensivos y tenemos 1,125 respiradores disponibles. Tenemos ahora 34 sitios de pruebas en la ciudad y el condado, y tenemos capacidad de hacer pruebas para 12,200 personas al día. Y al final del día hoy, hemos hecho pruebas a más de 86,000 personas en estos sitios y más de 100,000 en total en el condado de Los Ángeles. Estas pruebas son gratis. Por favor, visita la página coronavirus.lacity.org/testing si tiene síntomas. Es muy importante para su familia, para usted y para Los Ángeles. Y en Los Ángeles tenemos más de 50% de las pruebas en el estado de California, y el condado de Los Ángeles solamente es 25% de la población. Tengo mucho orgullo, especialmente por los trabajadores como los voluntarios y nuestros bomberos, que están ayudándonos en estos sitios de pruebas. Todos estamos sufriendo por esta crisis y estamos haciendo todo lo posible para ayudarles. Mañana, mis colegas en el Consejo Municipal estarán considerando avanzar una propuesta para que los trabajadores en industrias de servicio y hoteles, quienes han sido mayormente impactados por esta crisis, puedan ser los primeros para obtener sus empleos de nuevo cuando empezamos a reabrir la economía. Gracias al presidente del Consejo Municipal, Nuri Martínez, los concejales Corretz, Mike Bonin, Karen Price, Marquise Harris Dawson, todo este equipo, especialmente en nuestra comunidad, muchos latinos, inmigrantes en estas industrias, y ellos merecen sus trabajos cuando nosotros podemos reabrir la economía. Pero también necesitamos apoyo federal. Hoy supimos que California, el estado más grande en el país, recibió el menor número de préstamos por cada 1,000 pequeñas empresas en el país. Este no es aceptable. Esto es, para mí, una visión de discriminación contra este estado. Y las pequeñas empresas deben recibir prioridad en California, en todos los estados de los Estados Unidos. Además, supimos que más de 1 millón de personas fueron rechazadas de recibir sus cheques de estímulo porque están casados con inmigrantes sin números de seguro social. Este es racismo, este es discriminación y este también no es aceptable. Estas personas son enfermeras, médicos, trabajadores esenciales. El excluirlos a ellos es inaceptable, imperdonable y no refleja el espíritu americano. Nuestra ciudad está colaborando también con las escuelas para ofrecer alimentación en ciertos programas de cuidado infantil y mirando cómo cerrar la brecha digital para que todos los jóvenes de Los Ángeles puedan seguir la educación desde la casa. El distrito escolar ofrece varios recursos en la página coronavirus.lacity.org/resources. Ayer tuve la oportunidad de hablar con unos jóvenes increíbles de nuestra ciudad. Esta conversación la pueden ver esta noche a las 6:30 en mi página de Facebook y en PBS, KCET. Todos hemos tenido que cancelar celebraciones y planes y todos estamos sintiendo tristeza y preocupación sobre esto. Datos de la línea de crisis por texto nos muestra que los americanos sienten no solo ansiedad sobre el futuro, pero también soledad y depresión. En estos tiempos, más de 50% de personas comunicando con la línea de crisis por texto están utilizando terapia y servicios de salud mental con mayor frecuencia. Si necesitan ayuda, hay recursos para ustedes. No duden, por favor, no duden en llamar nuestra línea de servicios para salud mental disponible 24 horas al día al 800-854-7771. Es un servicio del condado de Los Ángeles. Y para familias y estudiantes del Distrito Escolar de Los Ángeles, pueden contactar al 213-241-3840 para hablar con un terapista entre 6 y 6 de lunes a viernes. Y todos pueden comunicarse con la línea de crisis por texto con enviar HOME al 741-741. Todos estos recursos se encuentran en la página coronavirus.lacity.org/resources. Esto no es para siempre. No se deben sentir sin esperanza. Somos una familia en Los Ángeles y ustedes, especialmente los jóvenes, son una parte integral, no solamente de nuestro futuro, pero nuestro presente. Ustedes son joyas en nuestra ciudad y estos recursos están aquí para usted. Lo que estamos haciendo está funcionando. Entonces, amigos, quédense en buena salud, quédense protegidos y quédense en casa. Mucha fuerza y mucho amor, especialmente para nuestros jóvenes. Gracias.